Welcome to HealthCast, a production from Lexington Medical Center that focuses on the latest procedures, treatments, and the people behind the exceptional care that we provide to patients. Today, we are exploring a new heart and vascular procedure that is transforming the way doctors treat patients with blood clots. I met with Jill, a nurse and mother of 3 who had a life-threatening blood clot. Walking side by side with her daughter is something Jill loves. She and Abby walk on a regular basis every chance they get.
That's one of our favorite things to do. We have a trail around our church that we walk around, going down to the river and walking by the river walk. We just love to be outdoors and with each other.
Jill thought one of those walks may have been the reason for a cramp in her leg, but that simple cramp would not go away.
So all you know is your calf muscle feels like it's cramping.
Yes.
But it was red.
It was hot.
It was hot.
And it hurt.
And it hurt. And you as a nurse knew that's not normal.
Right.
What did you think it was?
Oh, I knew it was a blood clot. I knew it was.
Did it scare you?
Yeah.
Because
I knew the complications of it. If that broke loose, I could have had a heart attack. I could have had some respiratory issues. I could have had a stroke.
Fortunately for Jill, Lexington Medical Center is one of the few hospitals in the nation to offer the new ClotTriever and FlowTriever procedures. Dr. Robert Leonardi, an interventional cardiologist, and Dr. Gerald Fortuna, a vascular surgeon, were early adopters of this technology.
It's a game changer, to be honest. It is some of the most rewarding procedures that I do because of the immediate impact and how the patients respond and their functional status afterwards. It is night and day different on how these patients do and how they respond to us in the therapy. I don't think there's any question that we're on the right track.
The new minimally invasive technique is designed to rapidly remove the clots with better outcomes and a faster recovery time.
ClotTriever is a device that's designed to remove clots from the leg veins, which is sort of like a net that you would drag behind a boat to collect fish. It's deployed on one side of the clots and then pulled back through the clots, collecting them in the net, and then the net is removed along with the clots.
While the ClotTriever removes clots from the leg veins, the FlowTriever removes clots from the lungs.
FlowTriever is, think of it as a super long, fat suction straw. And we're able to get in and remove large volumes of clot very quickly. We're able to do it in a very efficient and low risk, low complication procedure.
Yeah, the great thing was I was only out of work for a week. Basically laid around for a couple of days and then got up and started walking again with my daughter.
What's also great about this therapy is that it seems to be safe. You know, the risk of a major complication like major bleeding or injury to a blood vessel or the heart or the lungs is super low. Mm-hmm. We know that we are way, way more likely to help than hurt by doing these procedures in appropriate patients.
Before the devices, patients could only be treated with blood thinners and clot-dissolving medicines, which Dr. Fortuna likens to Drano.
An evolution of how we treat these have gone from giving people Drano through their IV to try to dissolve and unclog a pipe versus having a tool where we can go and physically remove the clot from that bed and restore the flow.
And why is the tool better?
The Drano can actually cause bleeding in other parts of the body that can be devastating.
We were an early adopter of this technology for sure. I think we probably have the largest experience with this technology in the state. So for people with blood clots, whether it's the lungs or the legs, we have a multidisciplinary team that can manage those very effectively.
We're bringing techniques that are fairly unique from other areas of the country into the Midlands. We're ahead of some major tertiary university-based referral centers in that regard, and we're really honored to be able to do that.
How significant is it that Lexington Medical Center is offering this?
I think it's a win for our patients for sure. Not every hospital is offering this or comfortable with it or doing it routinely. We're also offering it in the context of clinical trials. And so it's definitely a win for our patients to have these options.
For Jill, the ClotTriever was more than a game changer. It was a lifesaver.
So when you came here, even though you're in the medical field, this was all new to you, right? But amazing that they offer it.
It absolutely was all brand new to me. I have been a nurse for a long time, and did not know that this was a possibility. But when it was offered, I was like, well, that's an amazing opportunity. And so thankful that it was available. I hated to think that I wouldn't be around for my children.
And should this happen again, ClotTriever
is definitely the way to go.
Yeah.
Absolutely. Glad that I chose LexMed for that.
As a recipient of the nation's highest ratings in heart surgery and the first healthcare organization in South Carolina to achieve the Heart Care Center National Distinction of Excellence, it is no wonder Lexington Medical Center continues to provide world-class care right here at home. To learn more about the advanced treatments performed at Lexington Medical Heart and Vascular Center, please visit lexmed.com/HVC. And be sure you hit the like button and subscribe to our channel to get notified of future stories in our HealthCast series.